this important topic, improving access to health care systems in the new normal, embracing technology is apt and noteworthy. In the ensuing minutes, Mr. Chairman, I will try to divulge briefly how Ghana has managed the culprit of the new normal, the almighty COVID-19. Dynamics of the health systems as pertains to our context in Ghana. Then I will touch on how digital technology has been used in addressing challenges in healthcare system in general in Ghana, and specifically to face COVID-19 pandemic now and after, and also highlight some of the challenges faced in the digital health system and how this can be addressed. Dr. Chairman, on 31st of December 2019, the World Health Organization was informed of cases of pneumonia of unknown cause in Wuhan City in the Hubei province of China. Then on January 2020, 7 January 2020 to be exact, the causative pathogen was identified as novel coronavirus. And on the 12th of February 2020, the novel coronavirus was named Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. The associated disease is now what we refer to as COVID-19, which was declared pandemic by WHO on the 11th of March 2020. Unfortunately for us, the day after the declaration of the pandemic, Ghana recorded the first 2 cases on the 12th of March 2020. Since then, several measures have been instituted by government and agents. To combat this pandemic, the government of this country adopted 6 strategic objectives. The first one, because all the cases that we saw for the initial stages were imported, we wanted to limit and stop importation of cases. Mr. Chairman, as you are aware, we did that one by closing all the borders to Ghana, land, sea, and air, from the midnight of 23rd March 2020. And all travelers who came in after the announcement on the 21st were all quarantined at the cost of government. We are also aware that out of the 1,030 passengers, about 10% of them tested positive. The second objective was to detect and contain cases. We in Ghana adopted the 3 T's: tracing, testing, isolate the positives, and treat them effectively to contain the disease. Mr. Chairman, as at midnight, 21st November, the total tests done in the country is 582,707. Total cumulative cases, 51,184. And total recovered or discharged cases, 50,029. That means 97.7% of our cases have recovered and discharged. Total number of active cases, therefore, which went up recently in the beginning of the month to about 1,500, has dropped to 832. The total number of deaths, unfortunately, is 323, which means the case fatality 0.66%. The third objective was to slow community spread. So public education and social distancing measures were put in place to slow down the spread of the disease. Schools were closed, but we banned all public gatherings and religious activities and encouraged social distancing, hand washing, and hand hygiene. We also enforced wearing of masks, which is still mandatory. We are all here in the new normal. Everybody is masked. The fourth objective was to care for the sick. Not only the sick, but the sick and the health givers. So a lot of treatment facilities and isolation centers and homes were all designated as treatment centers. Government provided also personal protective equipment for all frontline health workers and all health workers in general. Government instituted tax relief for health workers in Ghana, which started in April and has been extended to the end of the year. And we also give 50% basic salary as allowance for frontline health workers in inverted commas in COVID-19 fight from April, which has been extended to the end of the year. The fifth objective was to mitigate the impact on social and economic life. COVID-19, as you are all aware, is more than health crisis. Ghana has not been spared the painful economic and social impact that the pandemic has visited on the people of this nation, both big and small nations all over the world. The restrictions on movements has disrupted households and businesses with consequent job losses and reduced incomes in Ghana. To mitigate this and minimize disruption to the social and economic life of Ghanaians, especially the vulnerable, the government provided subsidy for water and electricity, no payment of water bills from the period of April, which has been extended to the end of this year, and 50% cuts in the bills of electricity till September, and free electricity for line users. Also, government provided relief for households, especially during the lockdown of the Greater Accra and Greater Kumasi metropolis, and various reliefs to businesses have also been given. For example, there is CAP business. That means that 600 million have been created as stimulus for small and medium-scale enterprises, tax filing deferment for companies, and Ghana COVID-19 Alleviation and Revitalization Enterprise Program, the CARES, or what is normally called the Obatampa. The last objective was domestic capacity and self-reliance. Government has always been saying that we want to turn this crisis into opportunities. So government has encouraged businesses, local businesses, to increase their capacity to make sure that we deal with the shocks and moving Ghana beyond aid. We've been working together with private sector to increase domestic production of PPEs and IPC materials and enabling environment for pharmaceutical companies to increase their production. Dr. Chairman, Ghana as a country continues to be confronted with increased demand of cost-effective, quality, and accessible health services due to a number of factors, including the rising trend of population growth, significant remote or inaccessible areas, rapid urbanization, increased double burden of communicable and non-communicable diseases with limited resources, inadequate and inequitable distribution of our scarce health professionals and infrastructure, and inadequate and poor transportation systems at district and sub-district level for service delivery, and so on. Above all, COVID-19 pandemic has further worsened the already challenging situation confronting the health sector. The pandemic continues to exert significant pressure on our healthcare delivery system in a diverse way. The aforementioned factors are creating a pressing need for a fundamental rethink of the way health services and systems are organized and financed in the country. Technology, therefore, presents opportunity and enormous potential for improving access, quality, and ensuring efficient management of our scarce health resources and reducing health costs to achieve the needed health outcomes. Dr. Chairman, the term technology in healthcare delivery has been defined by WHO as follows: that they are the devices, drugs, medicine, and surgical procedures, and the knowledge associated with these used in the prevention, diagnosis, and treatment of disease, as well as in rehabilitation and the organizational and supportive systems within which care is provided, unquote. Healthcare technology, therefore, is increasingly permeating all aspects of modern healthcare delivery, and undoubtedly, technological advancement has contributed to the increase in life expectancy, lowered morbidity and mortality rates, and generally to better health outcomes. Before COVID-19 pandemic, digital technology has already been increasingly leveraged in Ghana to accelerate, complement, and optimize healthcare services. The government, through the Ministry of Health and its agencies, have taken strategic steps to deploy and use various innovations and technology as vehicles to increase access to healthcare delivery, to improve evidence-based clinical decision-making, data governance for reporting and monitoring, improve cost efficiency, and also to ultimately drive the process towards achieving universal health coverage. Key among these are the logistic management information systems which have been put in place, emergency medical drone program which has been put in place, the human resources information system, telemedicine, teleradiology, telelaboratory, hospital information systems, surveillance outbreak and response management system, what we call the SORMAS, global epidemic prevention platform, various web-based systems, social media, and mobile applications. Ladies and gentlemen, it is important to note that the existence of the paradigm shift towards innovation and technology prior to the outbreak of the pandemic proved foundation for Ghana's health system to stand firm and prevail in these difficult times. In fact, if we are being placed as number 3 in the fight against the pandemic, it's because of the systems which were put in place before the pandemic. Of course, this could only be possible in an environment where the leadership and governance system are spearheaded by advocates who believe in the appropriate use of technology for enriched outcomes. Ghana at the moment is using smart economy, and for that matter, we are also using smart health to achieve our goals. Mr. Nana Chairman, or Dr. Chairman, sorry, technology has proved as a useful and necessary tool to help ensure continuity of healthcare delivery in the midst of COVID-19 crisis. From the beginning of the crisis, the health service adapted and used digital technologies as an enabler to monitor, anticipate, reduce staff exposure to all ill persons, minimize the impact of patient surges on facilities, and influence the spread of the disease, as well as to provide education for the general public on the pandemic. The digital technologies have supported in the surveillance, laboratory, case management, contact tracing, media scanning, event-based surveillance, systems monitoring, and data visualizations. These digital solutions include SOMAS, DIMS, LHMIS, which is the Logistics Health Information Management Systems, digitized health data, media scanning, emergency communication system, COVID tracker, traffic monitoring, system uptime monitoring, ArcGIS, and recently we are adding what we call the PanaBIOS. SOMAS system, which is the Surveillance Outbreak Response Management and Analysis System, is an electronic tool for complete integrated disease surveillance with a capability of outbreak management and contact tracing. Components of SOMAS in surveillance, laboratory, case management, and monitoring and supervision collect data from the community and health facilities, from the sub-district, the district level, regional level, and national levels, and these informations are sent at any level, is seen at real time by the higher reporting levels. SOMAS has been successfully deployed in all regions across the country for real-time surveillance information and currently being used for rapid collection of surveillance data on COVID-19 outbreak. All COVID-19 testing laboratories, I'm happy to say, are using SOMAS to update results of all samples collected and sent to them. There is a seamless integration between the health facilities, the district and public offices, and the laboratories. Dr. Chairman, DIMS is a comprehensive electronic solution for reporting and analyzing of the needs of district health administrations and health facilities at every level. It has been designed to provide a comprehensive health information management system, solution based on data warehousing principles, and a modular structure which can easily be customized to the needs of the different health systems at national, regional, district, and sub-district and facility levels. DIMS is now accessible to all districts. Currently, we have about 1,178 sub-districts using the DIMS. It is used by over 8,140 health facilities, including CHIFs, to collect, collate, transmit, analyze routine health services data at all levels. There are currently about 15,000 registered Ghana Health Service and Ministry of Health users. Data on COVID are inputted into DIMS for case aggregation. The next one we'll be using is electronic medical records. Example, we have the Lightwave Health Information System in hospitals, information management system, and that is used in health facilities for patient care. There are other health information, what we are doing also as pilot in various hospitals. The system involves the networking of all hospitals, clinics, and community health centers in the regions, as well as the districts, and the networking of all agencies under the Ministry of Health. Electronic medical records has the ability to send notifications to the National Disease Surveillance Department about any patient who meets the case definitions of any of the priority diseases under public health surveillance. Once a patient is flagged, a notification is sent automatically to all responsible health officers who carry on further investigations, including taking samples when the patient meets the suspected case definition. The patient is then migrated onto SORMAS for further processes, which include case management and contact tracing, and then further into the DIMS for case aggregation. As part of the preparedness for the reopening of our borders, decisions were taken to drastically remove the waiting time on arrival section at the airport. This is to reduce contact period among passengers. Therefore, the data which was collected has now become electronic health declaration form, which is seamless, migrated into the routine surveillance system and also into SORMAS, as well as also into the DIMS data at the point of entry. Dr. Chairman, we also have other solutions like the emergency systems, the communication system, which is used for digital contact tracing using the phone numbers of all confirmed positive cases under home management. The system tracks the movement of all the confirmed cases and the persons they have possibly come in contact with. It also tracks whether the confirmed cases under home management are actually self-quarantined. The COVID-19 tracker application have also been introduced through the common platform of mobile networks, which is able to trace contacts of persons infected by the virus, show where they have been in recent time through various telephone-related data, and link such people to health professionals for urgent action to be taken. These applications, through the telephone system and related data, is able to report contacts which are or have recently been in contact with COVID-hit countries, as well as to track whether individuals required self-quarantine or other type of care. It is user-friendly, free to download mobile application available on both the YAM and also on sophisticated devices. We also have traffic monitoring system, which monitors all the data and health promotion messages, which is shared online with the general public. Platforms to message dissemination, including official COVID-19 website, as well as social media. So at any particular time, we know the number of Ghanaians or number of people who have gone onto the platform to look at the website of Ghana Health Service. System update monitoring is also used to monitor downtime and fix problems. In an emergency like this, and with all the electronic system deployed, we need to know which ones are up or down. And even when they are down, we needed a way to track the causes of the downtime while fixing the problem. We are also using the ArcGIS to be a better visualization of contacts and cases for the management and the general public with respect to geographical location. Ghana has developed a dashboard to report and share information about COVID pandemic in Ghana. The dashboard was launched on the 24th of April 2020. Dr. Chairman, we also, as a country, are using the drones, which is a remotely piloted unmanned aircraft system, which is used to distribute essential medicines, blood and blood products, and vaccines. Ghana uses the drones in a unique way to reduce the amount of time it takes for COVID-19 test samples to reach the testing sites. We also use the drones to distribute PPEs to remote areas. The drones leverages on artificial intelligence. So far, there are 4 distribution centers located across the country: at Omanako in the eastern region, Mpanya in the Ashanti region, Vopsi in northeast region, and Sehuyo also in the west-north region. They are serving some 2,000 rural and urban health facilities. We are also introducing, which will come on board very recently, what we call the PanaBios. PanaBios is a secured, standardized, tamper-proof, transcontinental digital application suite for disease monitoring, spatial risk factors analytics, mass testing, process tracing, and outcomes tracking. It is built to provide biosurveillance and bioscreening technology data and insights to enable the creation of public health corridors within the broader African Union Open Corridors Initiative. It supplies the nuts and bolts of constructing a truly Pan-African post-pandemic reopening architecture, Ghana has been chosen as a pioneer to pioneer this platform. Dr. Chairman, with all these things said, there are challenges. As technology in the healthcare delivery system continues to evolve, concerns about confidentiality of patient information and the steps that must be taken to maintain privacy in our digital health system have already emerged. Privacy is a challenge in the mitigation of, for example, COVID-19, as health service looks towards technology to help trace patterns and movements of people through contact tracing applications. To address these concerns, I'm happy to say that Ghana has Data Protection Act. Ghana also have Electronic Transaction Act, and we are abiding by this wholly so that we don't have any confidentiality problem. We also have low level of digital literacy, especially among health workers. The level of digital literacy and the staff awareness of the required capability, access to training and support, and skills to enable patients and citizens to improve health and well-being through technology continue to be low, unfortunately, in the country. We need to improve the digital literacy as a fundamental shift towards government health digital agenda. The cost of infrastructure, IT infrastructure, including maintenance, is also quite high. There is a need, therefore, for increased investment to close the IT infrastructure gap to help put health sector in a much better position to take advantage of technological advancement in the healthcare industry. Dr. Chairman, in conclusion, ladies and gentlemen, as custodians of healthcare, physicians remain the leaders in the forward march of healthcare delivery, organization, and financing. It is therefore prudent to embrace advances in technology to our practice of medicine and the management of our healthcare system in general. I must therefore stress that all sectors of society have a role in ensuring that we leave no one and no place behind. In the current and post-response to COVID-19, it will be essential for us to foster innovative partnership with the civil society and the private sector to address and progressively close the digital divide. Through this partnership, I'm very sure that we can build from the crisis and make access to technology the new normal. Thank you very much. Long live Ghana College of Physicians and Surgeons. Long live Ghana. Thank you for your attention.
Thank you, Dr. Anthony Insiasare, for that excellent delivery. We'll call on Oswald Okaite to give us another poetry recital.
I am the hunter who never cocks a gun. I gave myself through the rays of the sun, put words to tell the story as it were. And these words I shall speak to your ears are not words only from my heart. These are words of the voices you may not be able to hear. And these, for those we choose to keep 1 minute silence for falling at the feet of death in this campaign against the pandemic, and to you, the many more, still standing as warriors till the banner of victory is up in the sky. So through the rise and fall of sun, in your sweat, we see your desire to save a dying land and desire to save people. Through the rise and fall of sun, we feel the beat of your heart that many must not pass through the gate of death prematurely, nor sit for long on the seat of illness and sickness. We understand your thoughts, your views, deep from the heart, that before the quest for wealth, we must first seek the welfare of health. For in health comes strength, and in the bosom of health lies your worth. So though you may not be adorned as it must be you reminded you are kept in the heart of the creator of this between and go called life. And he says every morning that the break of early dawn preceded by the early dawn cock, kokochioko, and the arms of the trees dance to the silent tunes of the air, and the sun that rises to dazzle the skies. He says, on behalf of me, of the fallen and the struggling to live, those who see in your eyes the hope of God to live, say, thank you, doctors. Ayeko Yadamase Akpe Gobo. Thank you.
Thank you, Mr. Oswald Okaite, for that wonderful poetry recital. We've been sitting for so long, and I have the privilege of introducing the special guest of honor. So whilst I do the introduction, I'll just crave your indulgence that we all stand to improve the circulation in our lower limbs. And after I do the introduction, when he comes to the podium, we'll all take our seats. So if we could all rise as I do the introduction in under 5 minutes. Our guest of honor is in the person of Professor John Japon. Professor John Japon is a public health physician and Vice Chancellor of the University of Health and Allied Sciences at Ho. Prior to this, he was for 5 years the Pro-Vice Chancellor for Research, Innovation and Development and Professor in Epidemiology and Disease Control at the University of Ghana. He is also an adjunct professor of international health at the Georgetown University in Washington. He trained as a doctor at Kane UNEST in Ghana and pursued an MSc Public Health and PhD in Epidemiology at the London School of Health and Tropical Health Service in Kumasi, Doma Hinkro, Navrongo, and Accra. He worked at Navrongo Health Research Center for 7 years and became Director of Research and Development of the Ghana Health Service for 12 years, where he was responsible for implementation research. He established and managed the Ghana Neglected Diseases Control Program for 8 years. Professor Japon's main area of research is infectious disease epidemiology. He chairs and serves on several international and local research review committees and scientific boards, including European Developing Country Clinical Trial Partnership, World Health Organization, and Ghana Food and Drugs Authority. Professor Japon has over 140 publications in peer-reviewed journals, over 50 technical reports, over 300 conference presentations, and a book on neglected tropical diseases in sub-Saharan Africa. He is a fellow of the Ghana Academy of Arts and Sciences, the Ghana College of Physicians and Surgeons, the Royal Society of Tropical Medicine and Hygiene, and the American Society of Tropical Medicine and Hygiene, and a member of the Ghana Medical Association. I'm sure you all agree that we indeed selected a most appropriate person for this occasion. Let us, with a round of applause, welcome Professor Japon.
Thank you so much for your kind introduction. The Honorable Deputy Minister. Me and honoring me to be a special guest at this special celebration. I happen to be a foundation fellow, and I have a confession to make. I was looking through the book, and I realized that I was not in good standing. I think after becoming a foundation fellow, I think it was 2005 or 2006. 2005. This is, I think, the second or third AGSM I'm attending. So again, I'm making confessions. But it is good that I am here. And if I can have the next slide, I was planning to talk about all these things, but Dr. Nsiansari has spoken almost about everything. So if I can have the next slide, I want to look at this whole thing in the context of the health system. Can I have the next slide, please? In the context of the health system, when we talk about the health system, normally the definitions from WHO will talk about the building blocks of the health. You needed help, and the person who was offering you the help was at the other end. And this cursor thing is going round and round and round. You know what I'm talking about? How do you do it? The bandwidth issue. So there is a need for us to engage the other sectors to ensure that even as we embrace the technologies, they become seamless in our delivery. Otherwise, it becomes a big problem for us who are implementing. So government financing the technologies and the commitment from government in doing this in particular is for us very critical. The next slide, please. There is the other issue of, so I talked about investing in the technologies and the need for us to accommodate and change our mindset. You and I are the people who should be driving the change of this mindset. Some of us proudly say, as for me, I was born before computers. Even Dr. Nkrumah Mills doesn't say he was born before computers. So why should you say you were born before computers and you take a back seat and not get involved in this whole process? So as far as the way forward is concerned, I think that we need to engage our training institutions in the first place to get all of us onto the same pathway and decide that this is the future for us. I mean, I was talking about the use of robotics and telemedicine and all that. Yes, they are great. And when you see them being done in some environments, it is just amazing. I had the privilege of going to South Korea as part of our collaboration, and I witnessed some pinhole surgery which was being done remotely with advice from a specialist in Seoul. I mean, it was just amazing. It was just amazing. And when you look at the people, say, but these are not special breed of human beings. We are all the same breed. And I believe if the Ghanaian were placed in those environments, they will be able to do the same. Just as some of us have gone to other parts of the world and excelled. So we need the facilitatory environment to be able to do this. Our healthcare institutions need to begin to train people along these lines, starting from our medical schools, our nursing training colleges, and all the health professional training institutions, so that we will be able to make the impact at a very early stage of our life, if we really need to embrace technologies, because that is where it must begin. Next slide, please. He talked about DIMS, the e-tracker, and all that. I don't know how many of you know about DIMS. We need to engage the public sector within which we work. DIMS is the District Health Information Management System. And many of us, especially the clinicians, don't even know what happened to the diagnosis that they make in the clinic that they are sitting in. All this is supposed to be collated and tracked into the health information system, so that at the end of the day, people like I or Dr. Nsiasare can come and show you some very nice graphs and tell you what is going on. You need to engage the system. You need to interrogate the system. So if you are running a diabetic clinic, the expectation is that you should be able to engage and interrogate the system to see how your diabetic clinic is doing in terms of outcomes, looking at your patient management, so that at this time where there is overcrowding, at this time where we want to ensure social distancing, you will be able to even schedule your patients to come at specific times electronically, so that they don't even have to come and crowd in a place. And sometimes, especially the cases who come for routine review, under these circumstances, sometimes they don't even need to be in the health facility. How do we engage the system such that we can use electronic means to improve our healthcare delivery. So, ladies and gentlemen, Mr. President and Chairman for the day, I think we have come a very long way as a country. The COVID-19 has been a big challenge for all of us. So far, the country has done pretty well in terms of managing the crisis. But things are lingering on. And as things continue to linger on, we need to ensure that we improve access, even under the current challenges. And the best way we can all do this together will be to embrace technology, irrespective of how remote it may be. Let us embrace these technologies that are available and are being used all over the place and be part of the train. Otherwise, we will be left behind. And I don't want any of you to be left behind. And on the last note, for many of you who have qualified now, I beseech you by the mercies of God that you don't go back to Konfanochi or to Kolebu Teaching Hospital or any of those places. The place for you is the whole teaching hospital. And you are very much welcome to help us build our new teaching hospital and the medical school. And I hope the rector doesn't send me a bill for advertising. I thank you all for your attention.
Another round of applause for Professor John Owusu Japan. Thank you very much. It's now time to do an honorary fellowship award for Professor W. Bradford Rockwell. To do that, I call on the acting rector, Dr. Henry Lawson.
I was waiting for my clap. Thank you. Thank you very much. We have now come to the section of the awards. We will start with the honorary fellowship. Because of the new normal, our awardee couldn't make it here in person. And so we are going to invite the surgery as noted below. You served as the director and facilitator for a number of courses, workshops, and research activities. One of the courses, the FLAP course, is currently being considered to be organized for Ghanaian surgical trainees and also in the West African sub-region for all surgical residents. You established an international plastic surgery educational exchange in KNUST and KATH for medical students and residents, from which many have benefited and many more will continue to benefit annually. Together with some fellows of GCPS, you are developing programs that will improve the surgical training experience in Ghana and the West Africa sub-region, which will be fully sponsored by the Global Surgery Project of the University of Utah. You have worked tirelessly with your Ghanaian colleagues
to establish the first ever Ghana College of Physicians and Surgeons Konfanoche Teaching Hostel post-fellowship diploma program in hand and microsurgery at the Konfanoche Teaching Hospital. Professor Rockwell, we believe that honoring you will put you in the international limelight, which will give you easier access to grants to enable you to do more for the Ghana College of Physicians and Surgeons. It will also inspire others to take selfless courses to ensure the development of our national and regional health system. For your immense contribution to capacity building, exceptional resource mobilization, and support for both plastic surgery training and service provision in Ghana, the Ghana College confers on you, Professor W. Bradford Rockwell, the award of the Honorary Fellowship of the College, the highest award of the Ghana College of Physicians and Surgeons.
The pleasure of meeting several times at West African College of Surgeons meetings. Rector Dr. Henry Lawson, Vice Presidents, Council, Academic Board, Fellows, and members. I am humbled to be in your virtual presence. I wish the COVID situation did not exist and I could be present in person. The Ghana College of Physicians and Surgeons has the important role of regulating medical and surgical education in Ghana. I applaud the president, staff, and members of the Ghana College on a job not only well done, but extraordinarily well done. My involvement in Ghana is centered in Kumasi. Professor Pius Egbeneku is a fantastic surgeon, administrator, and educator, along with his young mentee, Dr. Paco Hoyt-Williams, and the plastic surgery faculty and residents at Komfo Anoche Teaching Hospital. We have formed an international plastic surgery educational exchange. I congratulate Dr. Joseph Akpalu, Dr. Oheneba Owusu-Dansel, Dr. Emmanuel Adu, and the plastic surgery residents on continuing to advance clinical care and education. Our program began with a one-week trip 8 years ago where we worked together in the operating room. We added lectures, then began focusing the trips with specific but varying educational topics. We have now published 5 papers together, one of which was recognized and awarded the bronze medal in the best paper category by the prestigious American journal Plastic and Reconstructive Surgery Global Open. Most recently, with the involvement of the American Society for Surgery of the Hand, we have formed the first hand fellowship in West Africa at Komfo Anoche. American and Canadian hand surgeons will travel to Kumasi to collaborate, teach, and operate. Our 2 institutions, KNUST and Komfo Anoche Teaching Hospital in Kumasi, and the University of Utah, the United States, have permitted us to exchange medical students, plastic surgery residents, and teaching faculty to promote and teach the art of plastic surgery. We entice medical students with the beauty and satisfaction of a well-designed flap. We stimulate residents to surpass the status quo and accomplish more for the child with a cleft lip or the adult with a tissue defect from a malignancy excision. We challenge each other to find better ways to teach and better operations to perform. I am fortunate to have gained personally and professionally from our exchange. The award of Honorary Fellow is an extraordinary honor. Thank you from the bottom of my heart. I am truly humbled. I appreciate your confidence and look forward to many years of collaboration and friendship. Thank you.